Hi, good morning, everyone. This is Sarah of Spa and Wellness Mexicaribe, and today we have an exciting webinar titled Advanced Education for Cancer Care in Spas and Wellness Centers with Christine Clinton of Christine Clinton Wellness for All. Christine, how are you today?
I'm very good, Sarah. Thank you for having me.
Thank you so much for joining us. I'm going to let you get started with the webinar. And as we go through, if there are any questions that come in, we will answer those at the end. Thank you.
Okay. First of all, I wanted to say how pleased I am to be working with you, Sarah. We've known each other a long time, and we've been in the industry a very long time. And we've seen a lot of changes through the years as it pertains to guests with cancer showing up to the spa. And for a long time, we were taught that it's not safe to work with people who have cancer or have a history of cancer. And we know that that's not true. And we know that it's really up to us as spa professionals to teach therapists how to safely and effectively work with guests who have a history of cancer or who may be in treatment for cancer. So I'm really glad to have this opportunity today to dispel this myth that it's not safe to work with people who have cancer, because it actually is really helpful to them. It helps to manage their side effects, and it helps to really, to really allow the spa to be inclusive for all guests, regardless of where they are on their cancer journey. So I'm really pleased to have this opportunity to talk about it today. And we can move to the next slide. Fabi, can you move to the next slide? Thank you. So I had the opportunity to visit Mexico last year and earlier this year, and we trained lots of therapists at Iberostar and at Blue Diamond Resorts. Their therapists were, again, delighted to be able to welcome clients with cancer because, like I just mentioned before, they'd been told that it wasn't safe to work in that space. And so now they feel confident and really pleased that they don't have to turn anyone away because they have a medical condition. I mean, if you think about it, imagine saying if somebody had diabetes or turning away a guest who's pregnant because we're not trained to do that. We would never think that that's acceptable. And somehow we think it's acceptable to do that to guests who have cancer. And I think we need to understand that sometimes spa directors will say, well, we don't get that many people with cancer coming into the spa. But the reality of it is, it's because we're not asking them if they've had cancer or if they have cancer now. We're starting to see more and more destination spas having retreats for people who have just finished treatment for cancer or maybe just about to start treatment for cancer and they want to get away before they have to start surgery or radiation or chemotherapy. So for me, having big brands and well-known brands such as Blue Diamond Resorts and Iberostar, with many therapists going through the training program. So I'm very proud of the fact that we already have a foothold in Mexico, and we really hope to expand that offering. We have the program available in Spanish, and I have a wonderful co-teacher that I work with Horacio, and he joins me sometimes when we need support in language there. So we have a very robust program, and we're very proud to have partnered already with Iberostar and with Blue Diamond Resorts. So we can move on, Fabio. Thank you. So some of the other places that I have taught in are 5-star international resorts. They're all over the world, in Canada, the USA, and Asia for 4 seasons. The Ritz-Carlton resorts in the USA and Florida predominantly, with Shivasam Wellness Resorts in the Middle East, wonderful resort, Sulal in Qatar. We'll be going back there again to Qatar this year for the Global Wellness Summit, but also for some more training. And they're also in Thailand, and the World of Hyatt in the USA and in the Caribbean. I've done many, many trainings in the Caribbean, and it actually is difficult sometimes because the quality of care is not always equitable. let's just say. And we see that the guests that we invite into the training really don't have any support after surgery or after chemo. So it's always helpful for therapists to be able to know how to handle those cases. So the Caribbean, I think, is unique in some ways in regard to the lack of information for the guests themselves. They don't often know what's happening there. And for leading hotels in the world throughout Europe, I'm from Ireland originally, and I've trained all throughout 5-star resorts in Ireland and in the UK and beyond. So I'm very proud of those accomplishments so far. This is something that really fills me with joy, actually, to see how much progress we've made in the last decade for being able to welcome people with compromised health into our spas. So we can move on from that too. So these are some of the things we talk about. Why would you choose my program over anybody else's program? And for me, well, a lot of reasons, but for me, it's because it's an award-winning program. We offer international certification, which means that therapists, regardless of where they are, if they're working on cruise ships or if they're working in your spa, or if you plan to move them around to different locations, if you're a big brand that has locations around the world or in North America or South America, you might want to have that international certification. The SATCC approval is, the SATCC stands for the Standards Authority for Touch and Cancer Care. And this is an organization that started in the UK by the world-renowned and friend of mine, Sue Harmsworth. And we started this program because we really felt we needed to have some standards in the industry as it pertained to cancer care. And because we were seeing so many clients show up with cancer or history of cancer, and some were sadly being turned away and were told we're not able to do a treatment for you. And really, we understood that to be lack of knowledge and not because there's any other reason. It was really lack of knowledge. So we put together some standards and a charter, and it's now a registered charity in the UK, but our programs are approved by the SATCC. In my classes too, we insist that we work with live models. And this is a very important part for me because I've been a massage therapist for 33 years now. And I think to teach a class without the right people involved is really, it's only half the class, in my opinion, because when you work with somebody who has cancer or who has had cancer, their experience is very unique to them. And they're not just another person that checks the box and says they have cancer. You start to understand a little bit about how it's affected them. Because one of the things we really need to understand is the long-term side effects of cancer treatment. You know, you might be going through treatment for 9 months, but the side effects can be lifelong. So even though you might think, oh, well, the client's, but it's 5 years since they had treatment, they should be okay. They're really not okay because the risk factors for lymphedema, for example, remain forever. Once lymph nodes have been removed or radiated, they're always at risk for lymphedema. So you always have to make those modifications. And sometimes, again, in speaking to the guests who have lived through cancer and are explaining their specific experience, you really learn how to tailor the treatment specifically for them. And we call that bespoke treatments. And I think it's really important to be able to do that because, again, if you have someone coming in for a facial, we'd never think that it's okay to give everybody the same facial. But why do we think it's okay for everybody just to get a cancer massage? And all you're doing is sort of stripping back what you normally do to try to make it gentle and easy, but not really looking at how can we really support this client where they're at today. Maybe it's a range of motion issue. Maybe they're not able to lay face down. Maybe we have to massage them on their side, you know, and maybe their issues are their hands and feet because they have peripheral neuropathy. So it's always important to have real clients that have gone through cancer to be our models. And I think it's important that that is a mainstay of what we believe. With the personalized training manuals, again, every therapist will get a manual for them, again, in English or in Spanish, outlining what the course includes and with some notes in there for them to refer to as they need. Every participant will also get a certificate of completion that is internationally recognized, and they get a pin that they can wear on their uniform that identifies them as a cancer-aware therapist. And as I said, the program is available in both Spanish and English. So we put a lot of thought into this. And as I said, I've been teaching it in English for a very long time, nearly 20 years now, but only in Spanish since this last year. So I'm very pleased to have had the help and support of Ignacio, of Horacio, who's been helping me with the presentation of the program. So we can move on now, please, to the next slide. Thank you. I mentioned earlier on about the SATCC, and this is their logo, and this would appear on the certificates for all the participants. So again, it stands for the Standards Authority for Touch and Cancer Care, and it recognizes the number of hours that a therapist will have gone through in the training. Our training's delivered over 3 days. So we know that you will have covered at least 20 hours of learning hours during the training. And that's very important because we know there are lots of courses out there, but some of them are online only, and some of them are in person, but not for long enough. And the more I teach this program, the more I'm reminded of how many questions we have afterwards. And that's why having our guests with a history of cancer there with us and having a discussion with them beforehand, really learning how to do a proper intake and understanding what's going on for them at that moment is very important. And so I think having the approval of the SATCC really means a lot to me and to the therapists who receive this program. Thanks, Fabi. We can move on. So when we look at the training, what's included, it's really based on 6 models, or modules, I should say. Module 1, what is cancer? Module 2, how is cancer treated? Module 3 are the side effects of cancer treatments. Module 4 are the drug interactions, because it's really important that we understand what the side effects of all the medications are so that we can best support the client. And then with module 5, we have safe and effective spa services. So that's oncology massage, oncology skincare, and also with the hands and nail treatments, and also treatments for the scalp, because there are times that the therapist will be, or the therapist will be seeing guests that have no hair, and we may be able to do a treatment unique and specific to them if they're at a point where they have no hair. And then for module 6, we talk about prevention and self-care, because it's really important that we understand that we need to care for ourselves as well as looking at a preventative lifestyle. And by that, I mean, nobody's blaming anyone for getting cancer, but we know that there are certain things we can do for ourselves that can help to prevent having cancer and other conditions, because we often see with a cancer diagnosis, there are other underlying conditions such as diabetes or heart disease, obesity, etc. So those things we often see with a client in addition to having cancer. So that's why it's important to really see the client themselves and to hear from them directly as to what's going on, because sometimes the side effects that they have are exasperated by the other conditions that they presented with before they even had cancer. So I think it's really helpful to hear and see the client yourself. Okay, we can move on. And so over the course of the 3 days, what will you learn? So you get to understand the unique needs of clients going through cancer treatment. And as I said, the mainstay for cancer treatment now is surgery, radiation, and chemotherapy. But you have to look at the guests that are coming to spas in Mexico. Most of your guests are coming from America and Canada, far more from the US than from Canada, actually. But, and we're talking about, significant numbers of people coming in. And what we know now is that every 30 seconds, someone in the United States is diagnosed with cancer. Every 30 seconds. I mean, that's pretty significant. So we know that 1 in 2 people born after 1975 will get a diagnosis of cancer. And that's around the globe. These are global numbers for every 1 in every 2 people. But in the US specifically, it's every 30 seconds someone will get cancer. So the idea that we need to be prepared for those clients is very important. And so there is a bit of a little misnomer in Mexico that we don't have that many clients coming into the spa with cancer. And I beg to differ. I think if you're asking the client if they have it, they'll probably answer. And so understanding what each client has gone through, because not all cancer treatments are the same. Some clients will get chemo, some will get radiation, some will get both. Some will have immunotherapy, and some people are on chemo for the rest of their lives. It's called maintenance chemotherapy. So we really don't know what the client's going to show up with. And that's why it's important to understand what each individual's needs are on that day. We get to understand the long-term side effects of cancer treatments, because again, chemotherapy has very different side effects than radiation. And again, immunotherapy, we're seeing more and more use of immunotherapy in cancer treatments. And there are side effects to that treatment too. Even though we're boosting immune function, we have side effects to that too. But we learn how to perform a detailed client consultation. And by that, we sit and spend time with the guest. We ask them, relevant questions, and spend at least 10 minutes with them before we put the treatment plan together, so we know what to do. And then we learn how to adapt the position or the pressure. We know sometimes they're not able to lay face down. Perhaps they have a medical device implanted. It could be a port. They could have a colostomy bag. They may have just had recent surgery, so they can't lay face down. And we may need to put them in a sideline position. We need to change our pressure, and we sometimes we'll always need to change the direction of our strokes. So these are just some of the things that we have to take into account. We're always going to be working up toward the heart. We learn how to recognize lymphedema. That's a very important aspect of the training, because as I mentioned in the introduction, lymphedema is a chronic condition. It never goes away. Once you get lymphedema, you have it for life, but it has to be managed. And so unfortunately, for people who've had cancer treatment, lymph nodes have been removed. It's basically how the oncologist can check to see if cancer cells are in the body. They go to the nearest lymph node that the tumor is draining to, and they remove those lymph nodes. So they look at them under the microscope and they have a look to see, are there any cancer cells? So sometimes they take a few, and sometimes they have to take all of the lymph nodes. So when that happens, then obviously that creates a whole problem for the client, because it puts them at risk for lymphedema. And lymphedema is a swelling of the body, and it can happen anywhere, not just in the limbs. It can happen in the face, in the abdomen. It can be anywhere. So in the class, we talk about what lymphedema is and what it looks like, and I've got lots of images. I'm a very visual learner myself. I need to see things to really understand it. So I have a lot of different teaching support in the class, so that a lot of photographs for you to see. And then we learn how to customize massages and facials. We learn how to make the adaptations. We learn how to assess what's the most important thing for the client once they've given us their intake. Like, what are the things that they really want out of the treatment? And in some cases, a client might have a rash. It's a medically induced rash, and they just want it to be calmed down. Sometimes a client is coming because they have poor range of motion in their shoulders, again, as a result of surgery or chemo. So we really learn how to listen and to take a detailed intake, so that we can customize the massage or facial to each and every guest. Okay, we can move on. Thank you. And practical hands-on experience. As I said, I can't stress this enough. It's so important to really have your hands on that client and see how we can help them. And sometimes the gift of touch itself is enough to help the client to relax. It's a very stressful time in their life to have a diagnosis of cancer. And the idea that we as spa professionals wouldn't be able to help them just doesn't seem like the right answer. And the answer is, we need to teach. I need to teach, and you need to learn how to do these techniques and how to understand what's going on at a cellular level for the client, so that we can really support them. So again, being in the classroom with the clients, hearing from them directly, and then putting a treatment plan together for them, and then carrying out the treatment and hearing their feedback in live time is really a great way to learn. Okay, we can move on. So there's been hundreds of therapists trained throughout the world. Some of these pictures are just ones that are some of my favorites, but on the left, it was the Four Seasons in Bali. And on the right, that was in Jamaica. And again, wonderful therapists all over the world. I'm always so impressed by the skill that I see around the world in therapists. And when I was in Mexico, again, it was a wonderful experience. The therapists at Iberostar were phenomenal, and the educators at Blue Diamond Resorts were so passionate about their work and so hungry for information, because let's face it, if you've been a therapist for any length of time, you've definitely had clients come in that said they have cancer and you weren't sure what to do. And we really want to, dispel the notion that it's not safe to work with cancer patients. It really is safe, and you're really helping them to feel better and to improve their immune function, because there's a lot of evidence to show that one massage, a 50-minute massage, can change the number of lymphocytes that are in the bloodstream. So, and that of course is part of your immune system. So you're actually boosting the immune system when you apply massage to the client. So I think that's a really important thing to remember. So I'm proud of this. Hundreds of therapists trained around the world, but thousands of guests are supported, because if we do 5 or 6 massages a day, just think how that impacts for those guests that are really struggling with their side effects of cancer treatment. So thank you. We can move on to the next slide. And that is it. Thank you for listening. I hope you got something from that. Again, for me, the most important takeaway is that it is safe to work with people who have cancer or have a history of cancer. And the other most important thing is that the more therapists we have that are trained in this modality, the better it is for everybody. So thank you, Sarah, for having me on today.
Thank you so much, Christine. Really informative. And we have a few questions, so let's address that. One question is the cancer care training available for all the spa staff? So the spa receptionist, for example, can provide the correct information to the guests.
Yes, absolutely. We work with the concierge staff because, like you say, they're the ones who meet and greet, and we want them to be fully aware of the language to use and what to say and what is acceptable language. So yes, we do.
Okay, fantastic. Do therapists need advanced English for this training and to put it into practice with guests?
You don't really need advanced English. I mean, some of the language is medical, so it's helpful. But again, I always have an interpreter with me to help if there's any misunderstanding at all. So we always make sure that we both have somebody who can speak both Spanish and English in the class.
Fantastic. Another question is, how long does the training take? I know you mentioned the course is 3 days. Is that complete, or is there something else afterwards?
So afterwards, there is a requirement to do case studies, and that's 3 case studies. So during the course of the training, every therapist will have at least 3 clients that they get to work on. And we just want them to write up about the 3 clients. So it's really what in the US, they call them soap notes. So it's like extended soap notes. In the UK and Ireland and elsewhere, the case study is written really simply to say what presentation the client had, what medical condition they had, and then what treatment we provided to them, and then some reflection, what did we think of the treatment and what feedback we had from the client. So it's easy, but it's called a case study, and there's 3 of those required.
Fantastic. Okay. One more question. Now that the industry is moving towards online education, could or would the theoretical part of the program be offered online?
Yay, good question. And yes, it is being offered online. We're just working on that right now. We have a platform and we have all the content. We're just trying to tweak it so that it really fits with what I have in my mind for it.
Fantastic. That's really interesting. Good developments. How long is one last question is how long is the certification valid for, and do we need to repeat the training?
Oh, that's another great question. So it's for 2 years, and the review is to renew the thing. It's just a half day online to renew it every 2 years right now.
Okay. Excellent. Well, I think we've given the audience a lot of information about this amazing training program that can really help the wellness industry deliver much needed therapy to a segment of the population that is growing. And then, like you said, there's more diagnoses every day, and we need to be able to cater to all of these clients that need this care.
Yeah.
And attention.
Well, I think they do. And I just, one of the things I was thinking of is the guests coming in from the US will be very used to being able to get oncology massage, because even the hospitals offer oncology massage. So if most of the guests coming in to Mexico have an expectation that they can get an oncology massage, and then the spa says, well, we don't offer it. It's really, a disservice to the spa, but to the client as well. So every spa should have it on the menu. And like I said, we'd never dream of marginalizing other guests. If a guest has diabetes, or a guest is pregnant, or a guest is obese, we'd never say, oh, you can't have a massage because it's not on the menu. So, we really shouldn't marginalize clients with compromised health either.
Absolutely. And obviously across our region, we have a lot of the population also going through different stages of cancer or in remission. But of course, we're welcoming guests from North America every day to spas all across our region. So there's
all
a
across
huge
the region.
market. Fantastic. I love to see that this is a growing interest in the wellness industry, and that more and more spas are getting educated. Thank you so much for everything you do.
Oh, thank you. Well, my passion started because, I don't know, the audience knows this, but my husband was misdiagnosed with lung and liver cancer 20 years ago. And that's really how I got involved in cancer care. I'd been a therapist for 33 years. And I was just completely shocked and taken aback, because we weren't expecting this diagnosis. It was actually an immigration doctor, because I'm from Ireland originally, and he was born in the UK. And we were just going to immigration, and they did an x-ray and said they saw something on his lungs. And after another MRI, they said they saw something on his liver too. So he was misdiagnosed. It turned out to be a hemangioma on his liver, and just scarring from TB on his lungs. But for 6 weeks, they said he had cancer. And that's what piqued my interest. That's how I got involved in cancer care. I never, started out thinking this was going to be my career, but, sometimes, life throws you a curveball, and you find yourself in a path that you weren't expecting. And so, after we went through all of the testing, and we got the results that it was negative for cancer, I felt I had learned so much during those 6 weeks that I couldn't unlearn everything I learned during that time. So Sloan Kettering in New York Cancer Center had an integrative medicine program, and I reached out to them, and I got trained in medical massage for cancer patients, and that was 20 years ago. And when I started, needless to say, the spa industry really wasn't interested in taking care of people who had cancer. They really weren't ready. And I think the last decade has been significantly growing, certainly in the US, Canada, and Europe. And then there's some other countries that are a little slower to embrace this work, and Asia as well, to be honest, is a little bit. And I just think, Mexico is more than ready. The therapists are the standards that I saw when I was there where they were great, and the enthusiasm and the clients that came in to share their stories with us. It was really wonderful. People are looking for this work, as I said, in Mexico, and for the guests that come in from Canada and the US. So I think it's a win-win for everybody to be able to accommodate all guests.
Absolutely. And of course, across Latin America, the Caribbean, all of these destinations where we're welcoming guests from around the world. That's fantastic. Thank you so much for sharing the information with us. That's been really valuable. We've answered all of the questions that have come in, so we're going to sign off now. And the video will be available, of course, for anyone to rewatch. Thank you so much, Christine.
You're welcome, Sarah. Thanks. And thanks, Fabi, for organizing everything. Thank you to those who participated and listened. And Maria is there, I see. Anyway, thank you all.